Perfect cholesterol, failing heart, the hidden metric that predicts heart attacks. A medical talk by Dr. Emily Carter. This should terrify you. This may be the most important medical case I have ever shared, because it proves something deeply uncomfortable. You can do everything your doctors tell you. You can take all the right medications. You can have perfect cholesterol numbers and still be silently moving toward a heart attack. This is the story of a 68-year-old man named Doug. And if you are over 40, this story matters more than you think. Introduction: who I am and why this matters. Hello, my name is Dr. Emily Carter. I am a medical doctor, and today we are going to talk about heart disease, without fear, without slogans, and without outdated thinking. What you are about to hear is not anti-medicine, it is pro-accuracy, and it may change how you understand your own risk. The perfect patient who was failing silently. Doug did everything right. For 14 years, he was the model patient. He saw top cardiologists, he took the best medications, he was compliant, he trusted the system. His LDL cholesterol, the so-called bad cholesterol, was 7. Yes, 7. For reference, most cardiologists are satisfied with anything under 100. Doug's doctors were thrilled, but something didn't add up. The shocking discovery: plaque kept growing. Despite perfect cholesterol numbers, Doug's coronary artery calcium score told a very different story. His score increased from 603 to over 2,000. That is not mild risk. That is severe, advanced atherosclerosis. He was on a clear path toward a major cardiac event. So how is this possible? How can arteries keep calcifying when cholesterol looks perfect? The mistake: doctors were watching the wrong number. The problem was not cholesterol. The real driver of Doug's disease was something barely discussed: his insulin, specifically his fasting morning blood sugar. Instead of a healthy morning glucose around 70 to 80, Doug had triple-digit fasting blood sugars. That is a screaming red flag for chronic high insulin, and high insulin changes everything. What high insulin really does to your heart? High insulin means the liver becomes packed with fat, lipoproteins are not recycled properly, fat particles stay in the blood too long. Doug didn't have many cholesterol particles, but the ones he had stayed in circulation for days instead of hours. That long residency time allowed them to become oxidized, become damaged, and stick to artery walls, all while his labs looked perfect. Why LDL cholesterol alone is an illusion. LDL cholesterol measures how much cholesterol is present. It does not measure how long particles circulate, how damaged they are, or how insulin-resistant your metabolism is. Doug's LDL cholesterol was low, but his metabolic system was broken. The real risk factor: insulin resistance. Insulin resistance is a far stronger predictor of heart disease than LDL cholesterol. And here's the dangerous part. You can have a normal A1C, a normal average glucose, and still have dangerously high insulin. This is where heart disease begins. The test most doctors don't order: LPIR score. To measure this, we use the LPIR score, lipoprotein insulin resistance score. It comes from an advanced NMR blood test. Score 0 is insulin sensitive, score 100 is severely insulin resistant. This score directly measures the damage insulin resistance causes to lipoproteins. The data. This is not a theory. A major 2021 study by Mayo Clinic and Harvard followed over 28,000 women for 21 years. They compared multiple risk factors. Results: LDL cholesterol hazard ratio 1.38, LPIR score hazard ratio 6.4. That means insulin resistance increased heart disease risk by over 500%. These numbers are not even close. What changed when the right metric was fixed? Doug didn't lower his cholesterol further. Instead, we focused on lowering insulin. He learned to measure fasting glucose, monitor ketones, fast long enough to reset insulin. Within days, morning glucose dropped to 96. Ketones rose to 1.2. This was proof his insulin was finally falling. Months later, his NMR labs changed dramatically. Small, dense particles disappeared. Larger, safer particles appeared. Liver fat began to clear. For the first time in decades, the root cause was being addressed. Common myths, clearly explained. Myth 1. Lower LDL always means lower risk. False. Metabolism matters more. Myth 2. Statins fix heart disease. They treat a marker, not always the cause. Myth 3. Normal A1C means you're safe. You can have normal glucose and high insulin. Myth 4. Heart disease is only about fat. It's about energy handling, not just cholesterol. When you should pay attention immediately. Take action if you have high fasting glucose, abdominal fat, fatty liver, rising calcium score despite statins, family history of early heart disease. These are metabolic warning signs. The core message: if you are only chasing LDL cholesterol, you may be missing the fire burning underneath. Insulin resistance is the silent accelerator of heart disease, and ignoring it costs lives. Final words. This is not about fear. It is about precision. It is about treating the cause, not just the number. Thank you for listening. Take care of your body. It carries you through life. Subscribe for clear, practical guidance.